helping make your life easier. Moms Every Day.
Hello, everyone, and welcome to Moms Every Day. We're joined today by Dr. Rodriguez-Sains, who is an associate professor of ophthalmology and chief of ophthalmic plastic surgery with Marshall University School of Medicine. We appreciate you being here to talk with us.
Thank you, Taylor.
Today, our topic is something very important, and I think it's a part of our health that a lot of us ignore and a lot of us don't really think about, and that's our eyelids. So kind of tell us about our eyelids. What is the purpose of them?
Well, the eyelids are not only to provide beauty, but they serve the main role of protecting the eye. But the thing is, many people don't really know what their eyelids are. They'll say, well, I have two. No, you have four. It's the upper and the lower. So you have an upper lid and a lower lid. And they are very special. It's the thinnest skin anywhere in the body. And it's a skin that's composed of many cells and many different tissues as opposed to normal skin, which is much thicker. So we need to treat it a little bit differently.
Why are they so important?
Well, again, they're very important because without the lids, the eyes wouldn't exist. We need to protect the eyelids. The blinking rate is what coats the cornea with a tear layer that prevents the corneas from drying out. And they provide many other nutrients and ingredients for the immunity of the eye. IgG, IgA, those are within the tears, so they're extremely important.
And a lot of us women are probably wondering, we wear a lot of makeup.
Right.
I know a lot of us on TV do. So what are the pros and cons of makeup use on your eyelids?
Well, and that's an important question. What I see, or what we see as physicians, is there are a lot of eyelid issues that are both cosmetically related and non-cosmetically related. Women tend to overuse makeup by placing it above the lash line, what we call the lid margin. That clogs the glands that produce certain oils for the eyelid's tear layer. And by doing that, you can develop a term we call blepharitis, or inflammation of the lids and lid margins, as well as chalazia or sty. The other thing is what you use as a makeup remover. A lot of folks use oily makeup removers, which adds insult to injury. You really need to use oil-free removers.
And sometimes as us women age, it's no secret, we get lines and the wrinkles, and that's something that a lot of us want to avoid. So as far as that, and some women out there may say, maybe I should start getting Botox.
Right.
What do you think about that? What are your recommendations as far as
Botox is a fabulous drug, and around the eyes we use it mainly at the crow's feet, the so-called lines, the laugh lines in the lateral canthus or the lateral area, and it works very, very well for that. As far as the bags or what we call dermatochalasis, normal aging changes of the upper and lower lids, there is surgery for that, as well as other techniques to smooth out some of the lines and wrinkles.
Are there any pros and cons to the surgeries, though? Because a lot of women may be saying, maybe I don't want to get it because of this. So are there pros and cons to it?
I mean, every patient is different. It's generally very safe surgery. Thousands, hundreds of thousands of cases done yearly. The absolute contraindication is an individual with an extreme dry eye, or individuals with major neurologic disease that affects the lids and things like that. But for the most part, for your average individual, it's a very safe procedure.
Very safe. Okay. And talk to us about eyelid surgery as far as that goes. What is eyelid surgery?
Well, eyelid surgery is surgery performed on the eyelids, quite obviously. But it is surgery, when we talk cosmetic, it is an eyelid lift. We remove excess skin, muscle, and fat from both the upper and the lower lids. And there are several techniques to be done to do that. One point before we go about the surgery is prevention of wrinkles, which I spoke a little bit about the last time when we talked more about skin cancer. And that is, sun protection is very important for the eyes, and because the skin of the eye is thin, you cannot apply a sunscreen to your lids. For the most part, that'll be very irritating. So what you need is UV blocking, sun blocking protection, and that's sunglasses. And
what does this surgery do for the patient?
The surgery removes the excess bags, the excess fat, that's usually lids, and it tightens the skin and the muscle. It generally makes you look rested, relaxed, It doesn't make you look 18 if you're 45, but it certainly adds a significant change to that portion that we first look at, and that's your eyes.
Sure. Well, Doctor, we appreciate you being here to talk with us today. Thank you so much.
Thank you very much.
If you would like more information at home, maybe you're interested in some of these surgeries, you'd like to get in touch with him, you can head over to WSAZ Mobile or WSAZ.com. All you have to do is click on the Moms Everyday tab. You'll find this interview and all that information there. Stay with us. We're back with more Moms Every Day after the break.